Welcome to SoCo Chat, a podcast where we talk with county leaders, discuss the latest news, and share all things concerning our home here in beautiful Sonoma County, California. I'm your host, Matt Brown, Deputy Communications Manager for the County of Sonoma. Thank you for joining us. Our topic today is a problem that is unfortunately entrenched in society, the opioid epidemic. Just look at these statistics. In Sonoma County, total drug overdoses are up over 60% since 2015, and opioids are largely responsible for the increase. 80% of overdoses involved opioids in 2023. Fentanyl, a powerful synthetic opioid, is contributing to the lethality. It was present in 90% of opioid overdoses in 2023, and 91 of 131 overdoses involved fentanyl. Here to talk with us about this problem is Will Gayowski, who is the Substance Use Disorder Services Section Manager for the County of Sonoma Behavioral Health Division. But before we get to our interview, I want to start with our trivia question. Our question today is, which U.S. state has the highest opioid overdose death rate at 80 per 100,000 residents, according to the Centers for Disease Control and Prevention? If you know, call us at 707-565-2242 or email us at publicaffairs@sonoma-county.org. If you are correct, you'll be entered into our weekly drawing for a chance to win one of our prizes, including a SoCo Chat coffee mug or a Pete's gift certificate. With that, let's get on with our discussion. Welcome, Will.
Thank you, Matt.
Thanks for being here.
Appreciate it.
You bet. Well, let me start with those statistics again that I mentioned in the intro. Here in Sonoma County, total drug overdoses are up 60% since 2015, so basically in the last 10 years. And opioids are really driving that. 80% of overdoses involved opioids in 2023. That percentage was 50% in 2015, so really the percentage of opioids has gone up. We also see the rise of fentanyl contributing to the lethality. Given all these increases in the past decade, what do you think is the underlying causes of the opioid epidemic?
It's a great question, Matt. It's really a complex and multifaceted situation of factors. You know, I kind of look at things in terms of a stress, vulnerability, protective factors model for our population as a whole. So if we take, imagine each individual and our vulnerability for addiction, where we have, our genetic factors. If we take a glass of water and imagine a bunch of pebbles, the more genetic vulnerability we have is taken up by the space of the pebbles. And we have water in our glass, which is our stresses. There's going to be a wide variety of things I'll get into in a little bit. And then we have our coping factors, our supports, our resiliency, and sort of like the metaphor and the model where, if we imagine it's kind of like an outlet valve for the glass, if we have a coping, so it could be like seeing a therapist or something, for instance, could take off some of that stress. For any person, any individual, when that glass is overflowed and there's access to a substance, we have vulnerability for addiction. Now, if we take that glass and we imagine 500,000 glasses, we have Sonoma County as a whole. So, so kind of the way I look at it is what are the things that are adding water to our glasses? Because we all have our own different genetic vulnerabilities that are, I think as my 14-year-old son would say, I'm built different. Each of us is built a little different, genetically speaking. But we also have different key factors like our adverse childhood experiences growing up. Who has, youth these days have more trauma. We have more anxiety. We have more depression. Our own mental health makeup, of which there is also a genetic vulnerability component, that takes up, so adding water to the jar of addiction, that when it fills up, addiction strikes, right? What are some of the other things that are key factors? Well, accessibility to substances. If it's more prevalent in the community, that's another vulnerability factor that's filling up your glass. What's also going to make that water sort of more potent in terms of overflowing for addiction is when we hit on, of those overdoses, 90% of them are having fentanyl in it. And fentanyl is far more important by an order of substantial magnitude over, say, heroin, morphine, other opioids. So not only are we, when someone's using, are we sort of adding water to when it's overpoured for addiction and for overdose risk, we're just dumping it in there. So it's more prevalent in the supply. It's more potent. And then there's I would say, the societal and communal risk factors as well. So, what are we dealing with? A housing crisis, a homeless crisis? What are we dealing with in terms of inflation? What of our political stressors in the environment? All of these things are adding in our own unique way with our genetic makeups across the population as a whole, uh, for producing overdoses, for producing opioid addiction. One of the other things, if we look at, and then we got to look at it in terms of a context of what are our, it's not all doom and gloom, right? Like we have coping services. If we have a robust treatment network, if we have a robust prevention network, those are things that can be outlets to sort of drain our collective jars and protect us and buffer us against addiction, against overdose. Of course, the caveat with the risk factor is we are in a nationwide, not California not accepted, shortage of registered and certified addictions counselors and of licensed practitioners of the healing arts. Those are licensed mental health professionals that are also qualified to treat these conditions: doctors, marriage and family therapists, social workers, nurse practitioners, and others in the same bucket, along with our addiction counselors. So I think when we take all of those factors together, it creates sort of a perfect storm for, unfortunately, a lot of overdoses, a lot of addiction, a lot of overflowing jars, glasses that don't have enough coping tools and resources to compete.
That's great. Thank you for breaking that down, and a great metaphor too. It's really lays it out, many factors. And I do want to get into some of those treatments and things that we're doing about it. So on December 1st of this year, Sonoma County will implement the Drug Medi-Cal Organized Delivery System. Tell us what that means for substance use disorder patients.
That means so much for our system. I think to kind of, it's, I think the waiver started back in around 2017 for other counties too. And once upon a time, our county, we did try several years back. Didn't work out that time, so we're taking our second bite at the apple. And we're super excited the state approved us to go live on December 1st. What it basically means is, like, when you and I, your mom, you go to your doctor, most of us have insurance, we have a health plan. And with that health plan for health services, we have a list of benefits that our plan's required to provide to us. Before moving to an organized delivery system, we're a state plan. We're not the same full comprehensive plan. So for instance, things like, outpatient treatment's covered on the state plan. Narcotic treatment programs and medication-assisted treatment, that's covered on the state plan. But residential drug treatment, that's not covered. Look at it as kind of like your doctor says, yeah, that's out of network. You can't have that. That's how it is under the state plan. If we look at care coordination, which is helping people navigate, helping people connect services. If you think about when you're trying to navigate the phone tree of your doctor and which clinic you go to for your health plan and that type of stress, imagine doing that while homeless, dealing with depression and a fentanyl addiction. We struggle with it as professionals ourselves sometimes, and it can be maddening. All those extra barriers makes it harder. Well, care coordination is a covered ODS plan, organized delivery system plan benefit that's, hey, that's not on the menu of what we can do for you and fund in that way. So first of all, what it does is it requires us in our agreement with the state where we become a plan. We provide a full menu, a full continuum of substance use disorder services. Outpatient services are covered still the same, but they're going to expand, and all the services are going to expand because the sources of state and federal revenue that we get increases in what's eligible for it. Like, it becomes eligible to draw down those state and federal dollars for residential treatment. We're eligible to draw it down for services like care coordination, those types of connections, or recovery services, which are things like relapse prevention or recovery coaching, things that we just had to fund a different way or simply couldn't before. So with all those savings and additional funds, we're able to provide more treatment and higher quality treatment of the levels we could before as a plan. So like outpatient, intensive outpatient, we can do and fund more of that and save money. And then also our narcotic treatment programs as well. We can fund that extra care coordination element in all of those programs to help people navigate the systems.
Yeah.
We can newly covered residential treatment program, which we couldn't before. So like if I go to the past, like if you call me and I have this conversation I hate having, and you say, hey, you know what? I got my Aunt Sally. She's been struggling with addiction. She's finally ready. And, I just need to get her into treatment. And I got to say, I'm sorry. I got a wait list of 18. It's more Aunt Fred's a bit better metaphor because we're a little more strict on male placements right now, Uncle Fred. But, the reality is we're allowed to do that because we're not a plan. What changes then is with that extra funding becomes extra responsibility. We have to provide those services. And if we can't do it in a timely way, we have more member rights, more timely access to care. And if we can't do it, the state says, well, tough, you got to execute a contract with someone to make it happen, because that's an entitled member benefit. That's a right. And there's a process where you can grieve it and advocate for yourself. You can advocate for Uncle Fred if he's not getting his residential treatment. You say, well, your program is you're waiting 10 days, 15 days to get Uncle Fred residential treatment. That's unacceptable. You're not allowed to have a wait list. I say, yep, you're right. Let's look at our options. And we either execute case-by-case agreements or larger contracts to expand our system. But that's it's more covered benefits, more growth. It's we have to follow specific evidence-based treatment models. So it's higher quality care, things like motivational interviewing, cognitive behavioral therapy, relapse prevention, psychoeducation, trauma-informed care. All of our programs are required to have 2 or more of those evidence-based models in part of their implementation. So there's more oversight, more services, more quality, and we save a lot of money, which is the best thing in terms of what it allows us to do in terms of supporting our continuum. What it really allows us to do is, I'm a big fan of upstream investments. What's the best thing you can do rather than reacting to a problem, right? If we look at the metaphor for like fires in our county, we want to prevent fires, right? We want to prevent addiction. We want to prevent overdose. So what do we want to do as a county with some of our savings, some of our extra funding that we used to use from state grants that we're now getting state and federal Medi-Cal dollars? Well, we can invest in more prevention in our system. We can invest in recovery housing. You look at like hierarchy of needs is, it's hard enough to navigate systems and get your needs met when you have a house. I can tell you it's a lot harder when you don't have a house.
Yeah, absolutely. And then you mentioned a lot of treatments that we're providing here and how to get those. A lot of those are long term and how to treat the epidemic. But one tool we have that can treat immediate overdoses if someone's actually overdosing right now. This is Narcan. This is a overdose reversal drug. Tell us a little bit about Narcan and how people can access that here in Sonoma County.
So Narcan is really a lifesaver. I mean, literally, pun not intended. It is a potent, non-addictive substance that is safe with anyone. You can have a very quick training for how to use it. It's administered by injection, or more commonly for lay people who get training on it, it's very simple, quick trainings, just intranasal spray. And it competes with and blocks the opioid receptors. So it just says, hey, you know what? Back off fentanyl, that's my spot. You're not affecting this person with their high, with their depressed breathing and everything else. And it can quickly sort of block those gaps with the pharmacology of the brain so that it, in a matter of minutes, reverses it. And the person is back to it, cancels out a lot of the effects of those depression, respiratory depression, the high, lethargy, all those things. In terms of Narcan, how can we get it?
Yeah, how can people access that, or are we making that more widely available? Or
No, we definitely are. So there's so one of the things that we've done is we have different community partners. One of the a great, I want to say, a benefactor of harm reduction and prevention in our community is Face to Face. They've done Narcan training and other prevention trainings in the community for years. So they've actually done some trainings for a few of our county outreach teams in the homeless services section. They've done some training for some of our internal substance use disorder teams to be trained to administer Narcan in the field and what to look for. As a county system as a whole for health services, we've been developing our Narcan policy. And so that includes what our plans are for training staff, what are our plans for storing inventory and making sure we track and deploy it to our fields, which which team members, such as like mobile support team as a crisis team that's in the field, which teams would we potentially require to carry it versus which staff would we encourage. We're going to encourage everyone to carry it, and based on staff advocacy, wanting to get this policy done, wanting to get the Narcan out in the community, I I don't think there's going to be any shortage of users wanting to carry that to help our community. Uh, One of the other things on the Narcan front is in our public health division, looking to make it more accessible in the community in terms of creating vending machines to deploy Narcan, also known as naloxone, testing strips for fentanyl, potentially testing strips for xylazine, hoping to deploy that in some key areas where there's more incidents of overdose in the community or more access nearby to substances. Hoping to look to deploy those, looking around end of October as a goal, as a timeline for that.
Yeah.
And hopefully looking to put finishing touches on our policy and start to roll out more system-wide training, because unfortunately the epidemic has a good head start on us and we need to catch up quick.
Yeah, no, I appreciate that. August 31st, this is Overdose Awareness Day. That's Saturday. To mark the event, to mark the occasion, there's an event from 6 to 9 p.m. at 1430 Neo-Thomas Avenue in Santa Rosa. Tell us about this event.
Yeah, so August 31st every year is Overdose Awareness Day. And, it's unfortunately, with all the impact of all this loss, there's a lot of need for awareness and a lot of need for healing. And I think this is more, and we heal through stories and grieving and community. And in this meeting, we have speakers coming to share of sort of how this has impacted them, impacted their family, which I think simultaneously boosts awareness in the community of what this is like at a personal and impactful level, but also helps the people that are suffering and sharing and passing that message on in terms of their grief and in terms of their healing. And grief being, complex with overdose and loss, we all grieve in different ways. Having a lot of healing through art. So we're going to have a commemorative art installation there as well, where people can contribute to that and grieve in their own ways. We're going to have educational resources with information on Narcan and prevention. We're going to have a Narcan training with our partner Face to Face out there coming up as well. So there'll be a lot of community building. We're going to have light refreshments out there. And it's kind of right out there in the parking lot. We're tabling it up. And I think we're going to have a pretty good turnout. I mean, right now, I think we're going to hit triple digits in a parking lot. So we're going to get packed in there a bit. But it's going to be, and then a candlelight vigil at the end to kind of close on a commemorative note.
Yeah, for sure. That's August 31st, 6 to 9 p.m., 1430 Neo-Thomas Avenue in Santa Rosa. And then there's September 20th, another event called Recovery Happens. That's September 20th from noon to 4 p.m. at Rincon Valley Community Park, 5108 Badger Road in Santa Rosa. Tell us about this event, Recovery Happens.
Yeah, so this is kind of about our version, and this happens all over the U.S., but our version in our county of Recovery Happens is all about celebrating recovery and the journey and what it means and the impacts in the community and supporting that for both, behavioral health. We're talking both mental health and SUD. It's not just about substance use disorders. And so we're going to have activities in terms of, our theme this year is the art of recovery. So we're going to have some painting activities. We're going to have some community-friendly competitions. We're going to have a kind of like an open softball tournament or casual games, depending on attendance. We're going to have barbecuing, enjoy some both vegetarian and meatitarian friendly options there for the grilling. We'll have games for kids. We're going to have a bounce house. And we're going to see what we can rustle up there too in terms of other games like cornhole. We might be able to snag some face painting in there. Still looking to shore up some potential activities. But I just think of celebration, resiliency, community building, food, and just all around a good time with the community.
Yeah, no, that sounds like a fun one. I want to talk a little bit about behavioral health, expanding prevention programs into schools. I know you guys are doing more opioid education and workshops in schools, supporting parents, supporting students and teachers. Is opioid use a problem for the youth, and why is it important to reach this age group with this message?
It's definitely a problem for the youth. It's not as, if we're talking about like overdose, it's not as high as say like you know, the 20 to 40 demographic, but we are, at times we've peaked at almost twice the incidence of California as a whole. So it is definitely a problem where it does happen. It happens in significant volumes and it happens at higher rates um, in our county. Um, with youth, it's sort of shifted as to what some of the causes are, the problems. Like one of the things we've seen in our prevention team is more of a shift towards a lot of the, when you engage youth, you figure, reason, what's kind of the reason, what's kind of the motivation. Because I've never met someone that's using that didn't have a good reason to use ever, having worked in the field for over 12 years. A lot of it now is kind of driven more by mental health needs. Hey, I'm struggling with anxiety. Hey, I'm struggling with depression. Hey, I'm struggling from recovering from my trauma. And when there's not the right environment, when there's not the right support or there's accessibility, it can be a formula for turning to substances as solutions for relief. One of the biggest challenges that makes it a tremendous risk for youth is you'll see awareness around it's just one pill can be life or death. Fentanyl is extremely potent. Your street chemists out there, they're not Jesse from Breaking Bad where they have all the scientific acumen in the world. They're not making a precise product. They're stamping it in at uneven ratios. One pill could be a totally safe, benign dose, and one pill could be lethal. And the risk to youth is you're taking things that you're thinking are ecstasy, or you're thinking you're taking a diverted amphetamine for studying, for energy, but those are getting cut or supplemented with fentanyl and other substances, and you don't know the amount. And it's a very, very high risk, especially when you don't have the tolerance for it and the potency of the substance.
Yeah, yeah. Is there anything else you wanted to say about the opioid epidemic here in Sonoma County?
I think some of the things I want to say about the opioid epidemic in the county are, that to truly convey the message of whether it's a first-time user or a chronic user that's struggling with recovery. This is, from studying the history from my career, this is the most dangerous time, I believe, to be an addict or to use substances, both with the increased potency of it, the prevalences of it in substances when you're thinking you're getting something else, but you're taking fentanyl. In terms of the reduction of workforce, so there's less supports, needs for more programming. It is a dangerous time to be out there. And whether it's going to our overdose awareness event or just getting yourself educated, watching some testimonials, stories move people, but really try to empathize. If you don't have that personal connection yourself, how would I be in this situation? Because we can tell you bad statistics until you're blue in the face, but the reality is until it hits close to home, either with empathy or with personal experience, it's hard. And we don't want anyone to be touched with this on a personal experience level. But again, what I'd add in kind of wrapping up, there's cause for hope, right? Public health, our epidemiological team is looking into things like these vending machines. We're analyzing patterns in the wastewater as to where there's more prevalent spots. We're monitoring what's there in the community. We're sharing statistical information with behavioral health so that prevention teams can use that to leverage solutions. We're going to be investing more and more savings we have from this waiver into our prevention team to beef it up. We've been talking with our contracted partners about how can we expand the opioid services that we are doing in our schools around education and prevention to develop more robust programs. And then, of course, with ODS having a lot more treatment options and the evidence base behind it. So I think while there's great cause for concern, we also have cause for hope and optimism to accompany it a little bit.
That's a great note to end on. Will, thank you so much for being here, for sharing that information, and thank you for working on this seemingly intractable issue. I know it's a lot of work. It's a uphill fight, but thank you for all that you're doing in this area.
Thanks for the time, Matt. And really, all the credit in the work really goes to our passionate community. We've got a lot of great contracted providers and even uncontracted partners, and a tremendous staff with the county. And we couldn't even attempt to put a dent in this without all their passion and efforts.
Absolutely. And as a thank you to you, we'd like to present you with this SoCo Chat coffee mug for being here as our guest. And to our listeners, we'd also like to give you a chance to win one of our SoCo Chat coffee mugs for answering our trivia question. As a reminder, our question today is, which U.S. state has the highest opioid overdose death rate at 80 per 100,000 residents, according to the Centers for Disease Control and Prevention? If you know the answer, call us at 707-565-2242 or email us at publicaffairs@sonoma-county.org. If you submit your answer to today's SoCo Chat question, you'll be entered into our weekly drawing, and then you will have a chance to win one of these mugs. And also, if you have comments about this or any other segment, or have a suggestion for a topic for a future SoCo Chat discussion, please email us at that same address, publicaffairs@sonoma-county.org. Thank you all, and we hope you continue to follow SoCo Chat on Spotify, Apple Music, Amazon, and of course, YouTube. See you next time.